At the very beginning, let's carefully analyze today's urgent and life-saving title: Seniors at Risk of Sudden Cardiac Arrest. This food strengthens the heart. The main health problem we are addressing is heart muscle weakness and electrical instability in seniors, a condition that silently increases the risk of sudden cardiac arrest, fatal arrhythmias, and heart failure after age 60. The promised solution is one specific natural food that strengthens the heart muscle, improves blood flow, and supports stable heart rhythm. This problem is especially dangerous for seniors because sudden cardiac arrest often happens without warning, even in people who feel fine and have acceptable test results. Aging weakens the heart's pumping ability, disrupts electrical signals, increases vulnerability to fatal events during rest or mild stress. The solution is critical because a simple dietary intervention can reinforce the heart at the cellular level, reduce stress on the myocardium, and dramatically lower the risk of sudden life-ending events. Now here is the shocking reality that every senior needs to hear. Medical data shows that over 350,000 sudden cardiac arrests occur each year, and adults over 65 are 4 to 5 times more likely to experience a fatal heart event than younger individuals. Even more frightening, studies reveal that more than 60% of seniors who suffer sudden cardiac arrest had no prior symptoms, no chest pain, no warning signs, no time to react. Imagine enjoying a normal day, sitting quietly at home, or sleeping peacefully at night, when your heart suddenly loses rhythm and stops. This is not rare. This is not extreme. This is happening every day to seniors who believe they were doing okay. Ignoring this risk can mean losing independence, losing mobility, or losing life itself. To guide us with medical credibility, we turn to Dr. Sarah Khan, a senior cardiologist with over 30 years of clinical experience treating more than 20,000 cardiac patients, the majority of them over age 60. Dr. Khan has spent decades studying why seniors with seemingly controlled blood pressure or cholesterol still suffer sudden cardiac events. Her findings are clear. Heart muscle strength and electrical stability decline with age, and medications alone do not fully protect against this decline. In her clinical practice, seniors who combined standard care with targeted nutritional support showed measurable improvements in heart pumping efficiency, rhythm stability, and exercise tolerance, often within weeks. This is not guesswork. This is the result of decades of patient outcomes and evidence-based cardiology. To understand why sudden cardiac arrest becomes more likely with age, we must look at the science. As we grow older, the heart muscle fibers lose elasticity. The mitochondria inside heart cells produce less energy. Oxidative stress damages cardiac tissue. At the same time, arteries stiffen, reducing oxygen delivery to the heart itself. Electrical pathways that regulate heartbeat timing become unstable, increasing the risk of arrhythmias. The heart is forced to work harder with fewer resources. This combination creates the perfect storm: a heart that looks fine on the surface, but is biologically fragile underneath. Understanding this mechanism is crucial, because it explains why strengthening the heart muscle itself, not just lowering numbers on a test, is the key to preventing sudden cardiac arrest. Unfortunately, many seniors unknowingly make daily mistakes that worsen this risk. The first mistake is excess sodium and processed food intake, which increases blood pressure, fluid retention, and cardiac workload. Research shows seniors with high sodium intake have up to a 30% higher risk of fatal cardiac events. The second mistake is lack of antioxidant-rich foods, allowing oxidative stress to damage heart cells unchecked. A third dangerous mistake is relying only on medication, believing it provides full protection, while the heart muscle continues to weaken silently. Consider the story of Mr. Ahmed, age 72. His cholesterol was normal, his blood pressure was controlled, yet he experienced fainting episodes and irregular heartbeats. When dietary support targeting heart muscle strength was added, his rhythm stabilized, energy improved, and follow-up tests showed stronger cardiac output within weeks. His story is not unique, it's common. Now, let's talk about the solution, the core promise of today's title. The food that strengthens the heart is beetroot. Beetroot is rich in natural nitrates, antioxidants, and anti-inflammatory compounds that directly support heart muscle performance. Inside the body, beet nitrates convert into nitric oxide, a molecule that improves blood vessel flexibility, enhances oxygen delivery to heart cells, and reduces cardiac strain. Clinical studies show that seniors who consume beetroot regularly experience improved cardiac output, a lower blood pressure, better exercise tolerance, and more stable heart rhythm. In control trials, measurable improvements were observed in as little as 4 to 6 weeks. The action plan is simple and realistic. Seniors can consume 1 small glass of fresh beetroot juice daily, or include cooked or roasted beetroot with meals. Morning consumption is ideal, but consistency matters more than timing. Pair beetroot with light physical activity such as walking, proper hydration, and a heart-friendly diet to amplify benefits. This approach strengthens the heart muscle, improves circulation, and builds resilience against sudden cardiac events over time. At this point, if this information is helping you, take a moment to like this video, subscribe to the channel, and comment with your age or heart concern. This channel is dedicated to senior health, heart protection, and longevity, because prevention today can mean independence tomorrow. As we conclude, remember this: sudden cardiac arrest does not announce itself. It does not wait for symptoms. But you are not powerless. By taking action today, by strengthening your heart naturally, you can preserve independence, protect your future, and reduce hospital visits and medical bills. A stronger heart means more years of movement, clarity, and confidence. Beetroot is not a miracle cure, but it is a powerful science-backed ally for the aging heart. Do not wait for a crisis to force change. Subscribe now and continue watching our videos to learn how to protect your heart, extend your life, and age with strength, dignity, and control.